At this ASH 2018, I presented some really long-term follow-up of the lenalidomide and rituximab original phase 2 study. And in this study, we were looking at untreated patients with low-grade lymphoma, including marginal zone lymphoma, SLL, and follicular lymphoma. And in this study, again, we used a combination of lenalidomide and rituximab for a total of 6 to 12 cycles. Pretty standard dosing of lenalidomide, 20 milligrams on days 1 through 21 of a 28-day cycle, and rituximab on day 1 of each cycle. If patients responded, they could get up to 12 months of treatment. We also enrolled a second group of patients, and these are patients all who had a total of 12 cycles of therapy. So just to back up, one group, 6 to 12, most of them only 6 cycles. The second group had all 12 cycles. And at this ASH, I presented with a median of 7.1 year follow-up the results of the trial. So many of these patients have been on the trial 10 years and some of them longer. And the good news is that at the current follow-up, the vast majority of patients still remain in remission. We have 70% or so of patients that are still in remission at a little bit over 7 years. In the 6-month treatment arm and in patients who had 12 months of therapy, a large percent of these patients are also in remission, slightly higher than 70%. Interestingly, in our analysis, it looked like there wasn't a dramatic difference in progression-free survival if you had 6 months or 12 months of lenalidomide. Why this is relevant is that as we are kind of moving forward with lenalidomide in the relapsed and in the frontline setting, the big question, which I think is going to emerge, is how long do you give lenalidomide? At least in our analysis, 6 months was very equivalent to 12 months, and really the great news is the vast majority of these patients are doing well and have not had any disease relapse at pretty long follow-up.